We are grateful that Jonathan could be here. He was also one of our presenters at our 2016 conference, and the presentation from that conference, which was on veterans courts and common pleas courts, mental health courts, is also on the Stepping Up website, the slideshow that you saw with all the presentations from the conference. But he's going to actually talk about one of the free programs that can really help reduce some of the jail medication costs if you learn how to use it effectively. And so I asked if he would come and make a presentation on that, and I'm very thankful that Jonathan was able to come.
Hello there. I'm grateful to be here through Justice Stratton and that. I'm going to talk about jails and mental health here a little bit. And I realize I'm the last speaker, so I'll try to keep it brief and short to the point. I work in a full-service jail that has 500 inmates, 501. Okay. I'm one of the few counties that actually accepts inmate medication from the outside. Not every county can do that, and I'm going to step through sort of the reasons why. The jail minimum standards, they were just revised for full-service jails in 2014, and I was chairman of the medical committee that actually introduced these standards, and we actually brought now a mental health component to it. So now they say medical and mental health, because I think it's extremely important that everybody recognizes that the jails in Ohio and throughout the nation are the #1 warehouser of psychiatric patients over and above state hospitals by a huge mark. So our little jail, we're a mid-sized jail. Last year we paid about $67,000 in just psychotropic medications. The year previous was about 53. We've had a tremendous increase in our costs that we are unable to control. But I've always felt that it's better if we accept medications, because as I'll point out here, this is actually the jail standard that it's derived from, and it's #2 that is the most important thing. Why don't we mandate jails to take medications? They're their own medications, right? Well, sometimes it's cost related. Now, to me, it does lower my cost. It reduces my verification time. In other words, if I have somebody comes in who may not know their doctor, doesn't know where they got their mental health services from, it takes me time to verify if they're on any medications or not. And it also increases continuity of care. But let's go through verification. Now, this process basically refers to verifying an inmate's currently prescribed medications. There was a Harvard study, 20% of initial medications don't get filled at all. So even though you bring them, we're not sure that you're bringing us all the medications. Without medical records or contact with a physician, we don't know if those medications are current. It could actually be in a current bottle, but the physician has taken them off of that and switched them to another medications. So it's not an end-all be-all. Plus, We have many prescribers. These individuals go to a lot of doctors who prescribe different medications, and the doctors are siloed and they don't understand who's prescribing what. So the jails are under tremendous burden here. So we go to authorization. Now that is the process that we review the verified medications and we decide whether or not the meds will be given in the jail. But you say, wait a minute, they were ordered by a prescribing physician, usually sometimes family practice, but a lot of times a psychiatrist. How can you not accept these? There's many reasons, but jails have to decide what's going to be given in jails, what we're going to have within our areas. A lot of inmates are on benzodiazepine. That's a very, very highly addictive drug and a very coveted drug. And a lot of institutions will not permit the use of benzodiazepines in their jails. Also, just because they're on the medication on the outside does not translate that they need it on the inside. The inside is a contained, rather safe environment. We don't see a lot of escalation. Of course, we do see our escalation in a few percentage of the cases, but it's a structured environment. So, what determines what is authorized? It's what's on the jail formulary. In Ohio and throughout the nation, it's the jail physician who now becomes captain of the ship as it relates to this inmate's medical and mental health care. It's not the outside doctor, it's not the consulting doctor, it is the jail doctor. He has final say. So we look for generic substitutions, and is that jail physician more familiar with certain medications? That has a bearing on it. And does the inmate still need the medication in jail, as I alluded to? So when you look at the factors of bringing in medication, it's just not as simple as one prescription pill bottle, leaving it off and the inmate automatically gets it. That's not what happens. When you drop off medication at our facility, in most facilities, I have to count it. Now, individuals come in with literally grocery bags of medications. To count all of those medications, and now that we're responsible for all those medications, is a burden. So you have to look at the size of the jail's medical staff. You have to look up at the makeup of the jail's medical staff. In other words, in some full-service jails, they don't have 24-hour medical, and officers are passing medications. So you have to be cognitive of that. Plus the sophistication of the pharmacy system and nursing to identify the medications. That's a huge problem, to identify all these various types. You know, losartan is a blood pressure medication. It has 3 manufacturers, 3 different pills that all look different. But they have to know all this. Plus they need the technological means to be able to look it up. But the number one reason jails do not allow inmate medications into their facilities is because the risk analysis of contraband. So why are outside medicines seen as contraband? Anytime a foreign substance is brought into the jail, it has the ability to become contraband, and it's extremely high probability. Pills are laced with outside medication, could be heroin, fentanyl. Capsules, the little capsules, they're taken apart and actually illegal drugs are put in them. We've had this at Stark County and throughout Ohio. Pills are actually manufactured to look like certain medications. And we have a difficult time identifying that. If it's a liquid medication, there's no telling what's in it unless you get a chemical analysis. And then what do you do with the meds that are brought in, counted, recorded, but for whatever reason not given? You can't put these medications oftentimes in the inmate's property. It's a huge responsibility now to store all that medications. The other thing is, and where the practice really started, was with prisons. Prisons never accepted medications. We would drive an inmate down there with their garbage bag full of medications, and they would literally, in front of the officers and the inmate, pour the medication out in a garbage can. So the jails stopped sending medications. Why waste all that? Now, we accept the medication, the inmate is transferred, what do you do with the medication? Now it becomes my responsibility to destroy it. So, sort of my thing is, don't get upset with jails that they don't accept medication. I think you can work with them. There are many that will be able to work with you and do accept medications. And if you can't, get them medical records. That's invaluable. And as I looked at this talk, throughout the nation, there's a trend where, because we know who's going to go to jail ahead of time, a great percentage, give them the medical record ahead of time. That stops the delay of, getting the inmate on Friday, and now, because all the offices are closed, I can't get anything until Monday, then I don't have it in stock, and so I've got it, now it's Tuesday before the inmate gets his medication. So we can do a lot by just trying to get those records ahead of time. There's my contact information. If you have any questions, I'll be happy to answer them. Yes?
I'm just curious, could a jail have a policy just specific to psychotropic medications? I mean, I understand all just a limit to...
Generally not. They may have a policy, though, that speaks to benzodiazepines and certain addictive drugs, yes. So it's a yes and no.
But a lot of psychotropics aren't addictive.
No.
I'm just thinking if they just limited to that, I mean, I understand all the problems if you open it to all of them, but
then you have to get very regimented. See, jails work in a regimented area, okay? So it's usually a all or nothing proposition. And so if you start allowing certain medications, that creates unrest with the inmates, that may present confusion with the employees, the nurses. So jails are much more likely to say yes on all of them or no on all of them. But can you? Yes, you can.
I mean, if you just said, here's the list, these are the ones we accept, there's really not that many, 8 or 9 of them.
Right. Yes, that would be a great suggestion, and I would always contact the health service administrator of each jail, because each jail has one, and then you can begin that dialogue.
Can you get a full picture view of the inmate's prescription record from ORS, or is that just?
No.
No, okay.
No, we can't do that.
Each jail has its own separate formulary?
Yes.
Set by that jail physician?
Yes.
Is there a trade association for jail physicians?
Yes, there is. Yes. I forget what it is. I think it's correctional physicians, if I'm not mistaken.
Have you seen more long-acting injections being utilized in jails, especially
No.
prior to the release?
No. Are you talking Vivitrol, or are you talking the long-acting?
We're talking about
Yeah. No. They're just too expensive. They're just too expensive. Those injections cost anywhere from $900 to $1,200 an injection. If we got a grant, I'd be happy to. Yes.
A number of us are with consumer group in Akron, and the greatest complaint I hear from about 50% of them been in jail is that they all have psychosis and they need their psychotic medications, but say that when they are going to jail, there's a delay where they can't get those medications.
Right.
And as a result, some of them began to decompensate. Would that be of concern to you, or?
Highly. I wrestle with that every day.
And how's that going?
Well, again, we accept medications, so we try not people don't decompensate in our jail without our knowledge. In other words, we definitely try to prevent that through medications, and sometimes even order additional medications to stop that. Let me tell you the real issue, and what just burns me up, is to get an individual pink slipped, okay? I have to let this person decompensate to a point that he is practically smearing feces on the wall or is overtly trying to hurt somebody. Now, I know he needs to go to the state hospital here, but I have to wait till here before I transport him. It's disgusting. The state system has decertified so many beds that of our last 3 pink slips that we've had to wait 48 hours in a jail before we could transfer those individuals to the mental health hospital.
Did you just say that the state system is disgusting?
Well, I said they're full. I said they decertified beds. We can't get the people we need, I'm speaking of jails, into.
Thank you.
We've had the state hospital say, he's too hard for us to handle. You have to handle it. Are you kidding me? Yes. Hi. Hey. Yeah.
So you work well with community folks to get medications in jail. So I've heard you talk a lot about the barriers. Can you talk about what you all have done at the Start County Jail to be able to make that successful?
Yes, we have policies in place. We accept all medications. If we can't verify it, identify it, I mean, if we can't identify it, we will discard them in our normal manner. Now, it does take a lot of staff time. It's tremendous, I can't tell you. But it's a commitment that we have that I think needs to be taken, because these inmates can't be out without their medications for too long. But again, it all comes down to dollars. What can the jail afford in medical staff, medical training to facilitate that? So we do allow. And then when they're released, we try and get them their medications back. If they've bought them, we give them back.
Have you documented the cost savings?
No, I've not actually looked into that. We're looking at too many things with stepping out. No, we just did get the price of psychotropic medications because the Howe Jail Advisory Board asked for that for the past 2 years. And there is some help possibly coming to jails for psychotropics. We're not sure, but we'll see how that survey did. Any other questions? Again, if you have any questions, concerns, give me a call. Thank you.